In this video, we will demonstrate administering medication through a peripherally inserted central catheter, also known as a PICC line, using the Mini Bag Plus system. Ask a friend or caregiver to watch this video as many times as needed to feel comfortable with this process. In this process, we will be using the Mini Bag Plus system, an IV tubing set, an IV pole, and a syringe tip cap if required. Alcohol wipes, normal saline flush, heparin if this is indicated by your provider, and a green Kuros cap. You will want to have hand sanitizer close by in case your hands or the end of the PICC line touches your skin. To begin the process, after following proper hand hygiene and having a clean work surface as described in your information packet, you will want to prepare the Mini Bag Plus system. Check the medication label for your name, the name of the medication, the directions for use, and the expiration date. If any information is incorrect, call the pharmacy. We will start by preparing the Mini Bag Plus system. Your medication is already attached to the solution bag. Begin by breaking the seal between the vial and the bag by bending up and down on the port of the bag to break the seal. Squeeze the bag to push solution into the vial until about half full. Shake or swirl the vial to mix the drug into the solution. This step can take several minutes. Make sure all of the powder is in the solution before continuing. Hold the bag with the vial upside down. Squeeze the bag to force air into the vial. Release the bag to drain the solution from the vial into the bag. Hang the medication bag on the IV pole and prepare the IV tubing. Open the IV tubing set and place it on the clean surface. Clean your hands with liquid hand sanitizer and rub your hands until dry. On the medication bag, pull the blue stopper off by pulling straight down and throw away the blue cap. On your IV tubing set, make sure the wheel is rolled all the way down in a clamped position to prevent liquid from running through the tube. Remove the cap from the spike and hold the tubing assembly below the spike. Careful not to touch the spike or have the spike touch anything else. Hold the port from the IV bag and insert the IV tube spike into the port. You can twist as you insert the spike until fully inserted. Now you can raise your IV pole to the highest position and prepare to prime the tubing. Before priming the tubing, gently squeeze the drip chamber on the IV tubing to allow the chamber to fill up about halfway with solution. You must prime the IV tubing prior to attaching your PICC line in order to get all of the air out of the line. To accomplish this, roll the wheel up and allow the solution to go down to the end of the line. Then clamp the tubing by rolling the wheel back down. If your tubing has a flow regulator as prescribed by your provider, adjust the dial to the correct rate for administration. Perform hand hygiene by using hand sanitizer or wash your hands with soap and water for 20 seconds. Now you will start the sash process. Sash stands for saline, administer, saline, and heparin. Remove the green Kuros cap from the end of your PICC line. Clean the end of the PICC line with an alcohol pad for about 15 seconds. Open the saline syringe. Hold the syringe straight up with the tip pointing upwards. Push the plunger up slightly to remove the air bubble. Connect the syringe to the PICC line and use the push-pause method with 3 strong pushes. Each push is followed by a short pause, which is about 5 seconds. Then push the remaining volume into the line. Remove the syringe from the line. Clean the end of the PICC line with an alcohol pad for about 15 seconds. Attach the end of the IV tubing to the PICC line. Remove the cap first. Then proceed to unclamp the tubing set by moving the wheel up to open the line. Administer the medication as directed on the label. Once finished, clamp the IV tubing by rolling the wheel down or using the clamp on the tube set. If you administer the Mini Bag Plus multiple times a day, keep the IV tubing attached to the bag until the next time you administer. Simply add the syringe tip cap to the end of the IV tubing to keep it clean. Cleanse the end of the line with a new alcohol pad for about 15 seconds. Open the saline syringe and remove the cap. Hold the syringe straight up and push up on the plunger to remove the air bubble, being careful not to push out much of the saline. Connect the syringe to the PICC line and use the push-pause method, which is pushing the solution briskly, pausing for a second and pushing again, with 3 strong pushes, then pushing the remaining volume into the line. Remove the syringe from the line and clean that line with a new alcohol pad for about 15 seconds. Open the heparin syringe, remove the end of the cap at the end, and hold the syringe straight up. This time pull down on the plunger to break the seal. The seal is very strong. If you push up to break the seal, you will push out all of the solution. So pull down on the plunger to break the seal, then push up to remove the air bubble. Connect the syringe to the PICC line and use the push-pause method again to add the heparin to the line. Finally, add the green Kuros cap to the end of your PICC line. Cleaning with the alcohol before the step is not necessary since the green Kuros cap is filled with alcohol. This completes the process to administer medication using a Mini Bag Plus system through a PICC line with the sash method. If you have questions, please contact us at 918-488-6660.